you here, and welcome back to Movement Every Day. Today we're going to do another video about trigger points to run off of last week. I hope you enjoyed learning about the upper trapezius a little bit and some techniques to kind of take care of those knots on your own. Today I want to talk about a very huge trigger point, and it happens a lot, and especially in this muscle, and even there's three technical muscles we'll talk about today, but I'm only going to kind of focus on one. But your glute muscles, that big old butt muscle, you have actually three different separate muscles within that one area. You have your glute maximus, which is the one on top, the big one. You have the glute medius, which is kind of more on the side of your glute and kind of on your hip area, which is in the middle. And then you have the really deep, a little bit more of a smaller muscle, more of a fibrous muscle called your glute minimus. And today I want to actually talk about the center one, the middle one, which is the glute medius, and how bad those trigger points and those knots, when those are in that muscle, can really cause a lot of pain, whether it's in your hip area, your back area. Plus, if you have any trigger points in the deeper one, the glute minimus, that can send pain, referred pain all the way down to your legs. So working on these with a couple techniques that I'll show you today will really improve those kinds of issues if that is the reason why. I actually want to show you the book that I've already kind of showed you before. Remember, it's the Trail Guide to the body's trigger points and all that stuff. So it's really good. But today I want to kind of show you about the glute medius right here. Okay, the glute medius kind of runs from the top of your femur, and it runs and goes up to the top of your hip or your iliac crest or your hip area, which you can feel on your sides, right on your sides. So a very common trigger point that we'll be working on here is the one in the posterior fibers or the back of the muscle here. And again, that can cause this whole glute pain. It can cause mostly central pain along the tailbone, but even run up to the low back and that side of the back. So a lot of times patients come in with low back issues. We get them adjusted. It doesn't really work much. It helps a little bit, but then we work on that trigger point with a couple of the techniques I'll show you, and they really see some improvement. Just to show you a little bit more referral pattern, it can kind of even go down the leg a little bit if you have a trigger point up there, or it can send right to the tailbone. I want to quickly show you before we move on the glute minimus. That's a really far deep one, but we can see how that pattern, that referral pattern, can go all the way down to the calf, even sometimes a little bit lower if you get more of trigger points in the front of the glute minimus, and that can be a real stinker for some people, because you get these pains and you're like, you don't know what's coming from. So I'm going to bring you into a separate room, and we're going to go over some techniques on how to improve this stuff so that you can do it at home. And if not, of course, come on in, see me, or see any local chiropractor or anyone that knows how to do some simple muscle work and to work on these trigger points for you. So let's head into the other room. Hey guys, welcome back. All right, so we're going to talk about two different ways that you can do this at home and take care of those trigger points that you feel in that glute medius. Most of the time you're going to feel that area, and it can be very tender, or if someone kind of digs in there with their thumb or their elbow and it really is just kind of having you jump off the seat, or even referring pain down when you poke on it, that's a classic sign that you have a glute medius trigger point. So like last week's video, I want to show you a simple one with a tennis ball. Again, I like the tennis ball because it's kind of soft and it's a good starter ball, but if you want to go to a lacrosse ball or a baseball, it's a little bit harder, that's okay too. So remember that glute medius, which if you remember the photo in the beginning of the video, it's kind of right here on the side and the back side of your hip area. If you feel for your hip bone right here, it's right here. If you feel for that crest, that iliac crest that we showed you in the book, it's right here. So that muscle basically lives within this section. You have fibers in the front, fibers in the back a little bit, and fibers down here. But as long as you put this tennis ball on that area, you'll roll around and find those trigger points or those tender areas. You just sit on them and you work them out. Get some blood, oxygen, nutrients in there. It will do you a whole world of good. So I'll show you kind of what it looks like. Okay, you get on your side. Again, you put that tennis ball kind of right there, and you just kind of find that. Oh, see, I'm on one right now. You find that tender point, and you can kind of just sit there on it, or you can roll back and forth. You're going to kind of put some weight on your elbow here, and you're just going to kind of roll around. Very simple. It's not rocket science, guys. Just have fun with it. It's going to hurt a little bit, but it's like a good pain. You'll get through it, and then once you start working on it for a few minutes, rolling back and forth, do both sides, it usually gets a lot better, and you'll feel really good after, okay? So try that with the tennis ball, okay? Last one that I like to do more than the tennis ball, because I just use this and I just basically foam roll my entire body on some workouts, is I just grab my foam roller. Real quick on foam rollers, I'll probably do a video in the future about this, but I like the foam rollers that have a little bit of ribbing on it, and one that you can see through. Okay, one that it looks like a PVC pipe that has some some soft material on top, because these kind of last a lot better than just those foam ones that you've seen out there. But we'll go over some of those in the future. But again, to do the glute medius, essentially the same thing as the tennis ball. I'm going to sit on the foam roller with my hip and it kind of on the back, and I'm just going to roll up and down on it. Okay, you're going to roll over those tender areas. You can kind of roll a little bit more forward, get that more front of the anterior fibers of the glute medius, and you're just going to roll them back and forth. Even lean back a little bit, get more at near that tailbone area, and it rolls really nicely. This is actually, I think, a little bit easier to start off with, because that tennis ball sometimes is very, very local, it goes right to that trigger point. This, it's kind of spread out over the whole glute. So obviously we're trying to target the glute medius, but you're going to hit other muscles, you know, that's a given, okay? I hope this helps. Remember, like always, like, comment, and subscribe. Go over to the YouTube channel if you're not watching on YouTube, and hit that subscribe button, because it really helps me out. Plus, you get to see the videos when they first come out. Until next week, I hope you have some fun with this. Let me know how you like it. By the way, I want to know if it really hurts you, if it's that good pain like I like. And we can laugh together, and also just kind of see how you treated yourself and see if it worked, all right? So leave those comments below. And until next week, remember, movement's everything and movement's life.